Hi, welcome. My name is Bert Scholl. I'm with the Cancer Resource Center, and this presentation by Leticia Shelton is brought to you by the Cancer Resource Center and their Cayuga Cancer Center of Cayuga Medical. So, Leticia, welcome, and I'm going to hand it to you.
Hi, good evening, Bert. I'm happy to be here.
Wonderful.
So my name is Leticia Shelton, and as you can hear from my accent, I come from France originally. I've been in the US since 2000. I am a dual citizen. I was born here from French parents, and when I needed to come find some upper school, I found an internship at DuPont in Delaware and came here, and I've been here ever since because I loved it. So I made the USA my home. So I'm an American with a French accent. I hope you understand me pretty well. So since I came here, I, of course, got married and got 3 children. They are 7, 10, and 13. They keep me very busy. And I started out doing a PhD in chemical engineering. So my DuPont supervisor, when I was doing an internship, suggested it, and I thought, that's not a bad idea. So I spent a few years at the University of Delaware getting a PhD, chemical engineering. And then I started working in a government research lab for about 12 years. While working there, I discovered aromatherapy. I was having my second child, and we were having a few health scares that year. A few things were popping up. And a friend recommended to try some essential oils, which I did. And I was amazed at how well they performed. They worked really well. So being the scientist that I am, I started researching what else can essential oils do? And I fell down a humongous rabbit hole. And while playing with the oils and using my scientific training to formulate various products, I just fell head over heels. And you know how it goes. Friends started asking me to make them things, and they referred their friends. And little by little, this became a company and took a lot of my time. So I could not perform all my jobs and raise my babies all together. That became overwhelming. So something had to give. And I just loved helping people. A lot more than writing papers, I gotta confess. I do like writing, but I like the research part, creating in the lab, putting my hands in the chemicals, a lot better than typing the papers. I do like giving the conferences, giving talks, yes, but the oral writing to me is the more boring part of the job. So I decided I was going to jump ship and try running my company. So I've been doing this for 5 years now. 10 years altogether, but 5 years with only 1 job instead of 2, plus the 3 children, which is already pretty busy. And 3 years ago, almost 4 years ago, during COVID, so I was doing all of this out of my house. And some shops near me closed, and I was able to move out of my house into what you see behind me. So this is a little shop with my lab where I am sitting, and I have a consultation room and a showroom where I display all my products. So that was a blessing. I was able to free up the humongous space I was taking in my house. And because the children have been home since COVID, we were too cramped. So this is good. I get more peace and quiet here to think. And my house was, I have to say, smelling very strongly of oils all the time, which is not good for people to breathe in 24/7. And also I have some cats. And as some of you might know, it is not, essential oils can be dangerous for cats. And my cats were not too pleased, especially when I was making a lot of smelly products. So it's been much healthier and better for me to have my own space here. Let's see. So I guess that's my story. So my company is called Dr. Frenchy because I'm a PhD and I am French. So, oh, yes. Sorry, I'm so sorry. I forgot about that. Mute my phone. There. All right. So now let's talk about the topic at hand. What are essential oils and aromatherapy and CBD, and how can they help with cancer and to live better with cancer? I'm going to start by sharing my screen. Let's see. Okay. All right, so essential oils come from plants. There are many different plants that are grown for the purpose, the sole purpose of producing essential oils. They are used a lot in the food industry and in perfumery, and more recently in the aromatherapy world, which has emerged, I would say, in the last 40 to 50 years. So to make an essential oil, you need a lot of plant materials. So you harvest the plant material that is relevant. These are the flowers, or the leaves, or the twigs, or the roots, or the bark. It really depends on the plant and the type of oil. And then they get put into a large kettle with water at the bottom. That kettle is closed to increase pressure while the water is boiled. So the steam, high pressure steam, passes through the plant material and extracts all the volatile compounds. They are the compounds that can mix with water while the water is hot and at high pressure. All the fibers of the plant, the chlorophyll, all the non-volatile compounds stay in the plant. That hot steam mixed with the essential oils and passes through a condenser, which cools the steam down. And then in the third vessel, you can see, which is green and blue. I don't know if you can see my mouse. Yes? Okay. So the green part at the top is your essential oil. Once it is cold, it re-separates from the water. So it floats on top. And then the blue is all the water that was used as a steam. It is not pure water anymore. As it separates, there's still some essential oil compounds that are soluble in it that stay in the water, and this is now called the hydrosol. Hydrosols are also used in aromatherapy and in food flavoring and in other businesses. Like you can buy lavender hydrosol, and it's a wonderful spritz. You can spritz yourself on your skin. It's very refreshing and smells nice. It only has a very small fraction of essential oils in it left. So then the green part, essential oil, gets put into bottles, and that is the oils that we use. So essential oils are the most concentrated plant compounds that we make. Plants are used in many different ways. I'm sure you all have had tea. A tea is very diluted. You get a little bit of materials into your water after you steep your tea bag. Then we have tinctures, which are a lot more concentrated. And then infusions, and then you have essential oils, which is the material 100% pure. There is no more water, no more solvent. It is just the pure organic compounds from the plant. What I like about essential oils is that they are so concentrated because it is very practical. You get a lot of power into a small package. So it is easy and cost-effective and space-effective to own several hundreds essential oils, even in a small lab like this. I can store them in the fridge, on the shelf, depending if they are temperature stable or not, and which I couldn't do with pounds and pounds and pounds of 100 different plants. All right, so let me show you what are essential oils made of. So this is a scientist geek. Just bear with me. The whole speech will not be science, but I just want to get you started with the right basis. So when you analyze one essential oil to see if it is a good quality, a good composition, is it proper? And every company who sells essential oil, the large companies do this to make sure that they got a good quality product from the farmers. This is the kind of result that you get. So this is called a gas chromatography analysis. And what probably looks like Chinese to you On the left are all the different compounds in the essential oil, and in the middle are their percentages, the number. So for example, I highlighted for you, and I will zoom in a little bit. So this is an oil of lavender. Lavender essential oil is not one compound. It's not the compound of lavender. There is no such thing. Lavender is made of mostly, as you can see at the bottom, linalool acetate, 51%. Then you have linalool, 27%. And then there's a tiny smidge of camphor, less than 1%. The quality of the lavender oil and the types of the lavender oil very, very much depends on the ratios of these compounds. As a scientist, this is what I look for when I shop for oils. I get the GC results. Sometimes it's also called GCMS, gas chromatography, mass spectroscopy. It's a combination of two different instruments. I look at these charts to find out the composition, to find out if this is a good oil or a so-so oil that won't smell so good and won't have very good results. So I know which compounds to look for the oils that I buy. So for something else about lavender to be aware of, when you buy a lavender oil, you might want to pull out these results because the camphor content varies very much. And the camphor content is very important because camphor is a neurotoxin. A little bit of camphor is fine and safe for the average adult, but it is not safe for babies. It is not safe for people with epilepsy or other neurological issues. So when you buy a lavender oil, you want to make sure that you check the camphor content, especially if you have some health issues where camphor could be a problem. Okay. So next, let's see. What do I? Let me see. All right. So last geeking out. So these are what some of those compounds look like. Okay. I picked the most famous. The shape and the size of the essential oil compounds very much determine the properties of each oil. Is an oil going to be relaxing, or is it going to be more energizing? Is it going to be more an anti-inflammatory or more of a bactericidal, an antibiotic? That will very much depend on what it's made of. Because one oil has, on average, 100 different compounds, one oil can do many things. I like to call lavender the Swiss Army of oils, Swiss Army knife of oils, because it can do pretty much everything in various proportions. So on this screen here, you can see limonene, the first one. That is the main component of all the citrus oils. Lemon, limonene, lemon, that's where it comes from. So it's a very small molecule. And because of this, it's a fantastic solvent. Because it is small, it can blend with almost everything, and it can melt some materials. If you put some limonene or lemon oil on a styrofoam cup, it melts. That's because of its small solvent-like properties. I use orange oil, which is pretty much 98% limonene, to melt glue. When you have some glue on the new appliance you just bought that you can't get rid of, try a little bit of orange oil on the paper towel, and that works better than alcohol, acetone, turpentine, nail polish remover, you name it. Orange oil, that is the remove oil. It's fantastic for also cleaning your furniture because somehow it does not melt the polyurethane on the wood, but it melts all the other grease on it. So it's very good for removing fingerprints, etc. And it smells fantastic. Okay, so next one is menthol, the main compounds of peppermint. Of course, you guessed it. And then we have alpha pinene, which is a main compound of frankincense and most conifers. So pines, spruce, fir, you name it. They're all mostly made of pinene. Terpinene-4-ol is the main compound of tea tree oil that everybody knows. Tea tree oil, a really good killer. when you have something strange on your skin, tea tree oil is the go-to, and very dangerous for cats. So not on the cats; they will kill your cat. And because of its structure and the OH group that is sticking out here, it is very good. It is very reactive compound, and so it interacts with bacteria and fungus and viruses and kills them. Camphor is the next one you can see over there. Then we have camphor is found mostly in rosemary, I would say. There's a lot of rosemary. You got to be careful with rosemary and young children and epileptics also. There's a lot in lavandin. There's lavender and lavandin. Lavandin is not the same as lavender. It's a hybrid that was produced in order to produce more. You get a lot more lavandin oil per pound of lavandin than you get of lavender oil per pound of lavender. So it was created because of its yield, but it has different composition. It has on average 20% camphor in it. So it's a big difference. But I love lavandin in bug spray because it's a lot cheaper than lavender. It's about 3 to 4 times cheaper. So if your lavender is too cheap to be true, it might have a lot of like camphor in it. It might actually be lavandin. So be careful what you buy. Linalool, linallyl acetate, I put them in purple because they are the main components of lavender. They are both very relaxing compounds while being slightly antimicrobial. And they can relax you when you're trying to relax, and they can help you focus when you're trying to focus. So very versatile. Most people love the smell of lavender because of these two compounds here. In red, you have cinnamaldehyde. Where do you think that comes from? From the name? Just to guess? Oh, but cinnamon. Yes. Oh, I saw Bert was trying to answer. Sorry, I'm so. Cinnamaldehyde, no, cinnamon is very aggressive. Cinnamon essential oil is extremely aggressive, highly allergenic. Never put it pure on your skin. When I blend, and I work with cinnamon, I put it in the blend last because just the cinnamon fumes start making me feel itchy. So I've been very careful with this one. If you put it pure on your skin, it will burn. It will burn a hole in your skin or you will be very red. So be very careful. It's an aggressive compound. Then you have the last one is beta-caryophyllene. Look how it looks like a heart. That compound is good for the heart. It is a strong anti-inflammatory. It is found in oils called copaiba, some might have heard of, and also black pepper. The oil of when you eat black pepper, it increases your circulation. It is very good for boosting your circulation, and so it is good for your heart. And so it's funny that it has a heart shape. Now at the bottom, we now have a triglyceride. Anyone know what a triglyceride is? I'll let Bert answer.
I'm trying to remember from school what a triglyceride is. That's not coming to me.
Okay, that is what vegetable oils are made of. Fatty oils. So essential oils are not fatty oil. They are called oils because they don't mix with water, but they are not actually fatty, like butter or olive oil. So triglyceride is what butter, olive oil, canola, avocado oil, peanut oil, all the oils are made from. And all the butters, mango, cocoa butter, etc. They're all made of triglyceride. Now, to put everything on the same scale, can you see the difference in size between the essential oil compounds and the triglyceride? Big difference, right?
Yeah.
Yes, so because of this, essential oils have very different properties from fatty oils. Fatty oils, when you put them on your skin, they will pretty much stay there. Some will penetrate a little bit, but because they're really big, the molecules are really big, they don't penetrate very well. They're very encumbered by their size. While the essential oils are very small, as you can see. They are very small. That is why they penetrate the skin and membranes and other tissues very, very well. That is one of their fantastic reasons why for their properties. And also that is why they are volatile, because they are small, they are light, and they can fly up in the air. Triglycerides don't fly. Try to get your olive oil airborne. Good luck with that. But the essential oils, just naturally, they get airborne because they are small. So that makes them reactive and volatile. One last slide. And then you'll see my face again. Fatty oils. These are some examples. So what are fatty oils good? Fatty oils are what you need to dilute your essential oils. Remember when I say essential oils are the most concentrated compounds we have from plants. Because of this, with great power comes great responsibility. You must re-dilute them, otherwise you can get hurt. As I mentioned, with pure cinnamon on your skin, you will get hurt. Pure oregano on your skin, oregano oil, will also make a hole in your skin. There are other oils like this that are dangerous pure. You must re-dilute them, most of them. Some are okay to use pure here and there, but in general, and these fatty oils are what you use to dilute your essential oils. Different dilution levels depending on age and the person and the sensitivity of the skin, etc. And you choose different oils depending on your purpose also. So there's many to choose from. I have about 20 different fatty oils in my fridges for my dilutions, and I choose them depending on my purpose. If I want it to penetrate or if I want it to sit on the skin, do I want it to be light? Do I want it to be really thick, etc. All right, here I am again. Yay. Oh, so that's for how essential oils are made, what they are made of. Now, what are their properties? Everybody knows some of the essential oil properties. I mentioned some in passing. So lavender being the most famous one, we all know that they can be relaxing. You smell a little lavender and most people immediately go, ah, I feel. So that is one. They can help reduce anxiety. Some are energizing, perk you up when you're tired. One that gives you a real kick in the booty when you don't feel like doing anything is thyme essential oil, T-H-Y-M-E. That one, physically, I had a girlfriend, she was depressed and not able to get out of bed. So I had a bottle of thyme shipped to her. She put it on. She said she cleaned her house so much that day that she hurt her back. She just jumped out of bed and started cleaning her house. So be careful when you use thyme. Just try 1 drop. She put 5 drops and that was too much. Just on the collar of her shirt. Put it over here, like I told her to do, and she just started going. So they're very different. Peppermint, many people know that it helps you with headache and with nausea. A lot of essential oils are being researched for their antibiotic properties. So some are antiviral, antimicrobials, antibacterial, antifungal, and what else is there? Antiparasitic, you can kill worms, etc. with it. So you can kill many things. Anti-infectious. The reason is because the plants produce these essential oils in the first place to protect themselves from predators and from insects and from mold and fungus. So that is why most oils, many oils are really good at killing things because that was the initial purpose of the plant. And all the relaxing scents, that's because plants also produce these compounds to communicate with their neighbors, to communicate among themselves. So they're also trying to attract the bees. So all the yummy flower smells are to attract the pollinators so the plants can reproduce. So the plants don't really make the oils for us. They have their purpose of reproduction, of self-protection, but we enjoy them very much because of all these yummy properties. Let's see, what else do they do? Some are very good at repairing. One of my favorite essential oils is called helichrysum. And ooh, I wonder if I can show you a picture. While I was just in France, I actually found some helichrysum. I was in the south of France, and I found some helichrysum on the path, and I took a picture because it's just one of my favorite oils, and I thought it was really yummy looking. Just show you real quick. Where did it go? So helichrysum is a flower that soaks up the sun. And heli comes from helios, Greek, for sun. And let's
How do
see
you
what's
spell
the
it?
screen share over here. There. All right. Another name for it, so Helios from the sun. It only grows in very sunny area. It soaks up the energy of the sun. And in the essential oil, you get a highly energized essential oil that is very, very powerful at fixing. Helichrysum always makes me think of healing. So it's my favorite healing oil. I use it on bumps and bruises and veins. And once I thought I had felt like I had a blood clot in my knee. After several days, I rubbed some helichrysum in it and I resolved it. It's great for recovery from viruses. It's an antiviral itself. It helps close wounds in the skin. It helps the skin produce more collagen. And the entire body produce more collagen. It's really a fabulous oil. It's my first aid oil. I always keep some in my purse with me. And as you can see, it is also called immortal because when it dries, it never loses its bright yellow color. So it looks like it never dies. And the little ants on it love it too. Okay, now where was I? Okay, so healing properties. So helichrysum and others, lavender, frankincense can also really good at repairing. So repairing the skin and many other ailments. All right, so now let's move on to cancer. I was looking up the latest research on essential oils for cancer. And there is a lot of research going on to try and find out which oils can help with various aspects of cancer itself. And I found some very interesting results. So you all know cancer better than me. But what I found is that most cancers are caused by DNA damage. And you can nod if you agree. And the DNA damage is mostly caused by highly reactive oxygen radicals. So they are oxidation products. And they bind to the DNA, forming an adduct, and then it causes a gene mutation when it's successful. It's oxidation of the DNA inside the cells. And the body has many mechanisms to, so this happens all the time, but the body has mechanisms to try to stop it all the time. There's several different safeguards. But when it happens too much all the time, then eventually the body can catch it all. And that's when it starts spreading. So there's several different stages on this oxidation turning into a tumor. And what research has found with essential oil is there are several different oils for each stage. So I'll give you what I found. So first, to prevent the oxidation itself. Everybody knows we need what? Antioxidants. So there's antioxidants all over our foods. And there are some excellent antioxidant essential oils. The best ones are oregano and thyme. They're the strongest antioxidant essential oils. After them come Dalmatian sage, peppermint, and rosemary. Those have been studied for their antioxidant properties. So these can help prevent the damage in the first place. After that, to prevent the damage, once the damage has occurred, to prevent it from turning into a gene mutation, some of the essential oils studied have been a blue chamomile. There's different types of chamomile. The blue one is also called German chamomile. There's lavender, really good at preventing the gene mutation. Rosemary again, and Dalmatian sage again. So sage and rosemary, two very good prevention oils. And then turmeric. We all know that turmeric is really good at eating, but the essential oil is also good for you. That's also one of the oils I like a lot. Now, in the stage 3, once the tumor, the cancer cells have already been formed, there are many essential oils that can help boost the immune system to start destroying the cancer cells. So the immune system knows how to do that, but it gets overwhelmed. And some oils that have been found to boost the macrophages, which are the large cells that eat invaders. So by boosting, I mean that it either causes to produce more macrophages or to make them more effective. We have found that eucalyptus oil was effective for this. the oils of dill and caraway, verbena, and all the citrus oils, anything with the limonene compound in it. But be careful, citrus oils need to be fresh. They oxidize, they go bad very quickly. So you must keep your citrus oils in the fridge, as well as all your conifer oils. Anything with pine, spruce, fir must be kept in the fridge, because once they oxidize, they actually become dangerous for you. They're not beneficial anymore. They become aggressive, and some studies were done with really old oxidized citrus oil, and they can start causing cancer because they become oxidants instead of antioxidants. So you want to make sure the antioxidant power is safe by keeping yours fresh. Okay, and oregano is also a great macrophage booster. So the next category is the natural killer cell booster. So natural killer cells are the ones who attack cancer cells in your body. And so a few oils that have been found to boost the natural killers are bitter almond oil. The benzaldehyde in bitter almond is the compound that is doing the job. And you might have heard about, there's a new trend of eating apricot seeds, bitter apricot seeds. I've found this all over the internet. And I think one of my clients with cancer told me about it. He helped treat his wife's cancer by feeding her bitter almond seeds, and they got a good result with it. So that would be from the benzaldehyde inside, which is an essential oil, and apparently selectively kills cancer cells, but not healthy cells. Some other compounds that help boost natural killer cells are linallyl acetate, which is found in clary sage, petit grain, and lavender. Then we have all the conifers, pine, frankincense, juniper, cypress, eucalyptus again. So eucalyptus is double good. The limonenes again, or the citruses, and the copaiba and the black pepper again. And eugenol. Eugenol was found to be especially effective. That's the main compound in clove oil, and also pimento and holy basil. So that's called eugenol. Very good at killing, helping to kill cancer cells. Okay. So many other compounds were studied that help in various ways in essential oils. So they can either help boost the DNA repair enzymes, so boost the enzymes that will repair the DNA after it got attacked by the oxidants. So that would help prevent the damage in the first place. Several oils do that. Some have been shown to inhibit the cell proliferation. Some were shown to induce apoptosis, which is a cell death. Some were shown to inhibit the angiogenesis, which is a creation of a blood supply to the tumor. So they prevent the tumor from creating a blood supply, so it dies. And some promote the cell differentiation so that the immune system can recognize the cancer cell from the healthy cells better. So let me show you one of my favorite books. Oops, it's upside down, reverse. Essential Oil Safety. This is one of my favorite books for geeking on the science and the chemistry of the oils. And in there's a chapter on cancer. If you're interested in finding out which oils do what, this is what I consult when I make blends for cancer. There's tables, there's 4 pages of tables, 6 pages of research on which compound and which oil was studied for which cancer. On human or mice or in vitro, they tell you everything. For example, basil, holy basil, the first one, was studied for stomach cancer in mouse, found effective. These are all the ones that were found effective. So if anyone wants to be serious about creating things for themselves or their family, you can ask me, or you can get yourself this fancy book, and you will see which oils have been tested for what cancers and found effective. I would also be happy to make copies of those tables to anyone who emails me and then email them to you. I can scan them and I'll be happy to email them. So the book is pretty expensive. So, okay. So now we know there are many oils that can help with cancer. Okay, that's great. But what do we do with them? I mean, how do we get the oils to the cancer? That's the problem, right? That is where I like to come in, because with my chemical engineering technique and all my years of research, I can pretty good at figuring out the mechanisms on how to try to get the oil. It's a little tricky. So there are three main ways to use essential oils. They are volatile, so they like to get in the air. Especially the warmer it is, the faster they get in the air. So the main way, the first way to use oils is called inhalation. Inhalation, breathing. When we breathe essential oils, the mechanism is four ways, three different ways, four ways. So first, as the oils enter your nose, immediately they trigger your limbic system inside your brain. Your limbic system controls your emotions and also the automatic reactions of your body. So just by breathing one molecule of lavender, immediately it doesn't have to do anything to you. It doesn't have a chemical action. Right away, your brain says, oh, lavender, relax. And it is your brain doing the job of telling your entire body to relax, telling your blood vessels to open up a little bit, vasorelaxation, lower your blood pressure, slow down your heart rate. If you like lavender, some people don't like it and get excited by it. So it's not universal. Your brain anxiety starts slowing down. You get many immediate effects just from the limbic system telling your body what to do. Secondly, as the oils fill your sinus cavity, they start traveling up the olfactory nerve, and a small fraction physically gets in your brain. So you can get some pretty deep brain effects, like anti-inflammatory, or maybe helping you fight some infection, or rebuilding, making new neuron connections, or helping to bring some oxygen. So you have to breathe a pretty big amount for that, but you actually get some in your brain. Thirdly, as the oils fill your lungs, they go into your bloodstream. And then from your bloodstream, they start coursing everywhere into your entire body. So you get a little bit of essential oils everywhere. And they're going to go to every cell. So the effect, in average, lasts about 2 hours, because essential oils get processed fairly quickly by your livers, and they leave your body fairly quickly. So if you want to use inhalation, you can diffuse. Everybody knows about diffusers, right? And my favorite is using these little tubes. Since I discovered these, I don't diffuse anymore, because the diffuser, I find it wasteful, and it can hurt the people around you. For example, if someone doesn't like the oil you're diffusing, they're not too happy, or they could be allergic. Or what happened to me in the beginning is I made my cat sick. I was diffusing and my cat started throwing up every day. And I didn't know why until I read that many essential oils are toxic to cats. So I switched to this, I discovered this, and that's a little tube. And inside this tube, there is a cotton wick. And I put my essential oil blend on the cotton wick, close the tube. This keeps it nice and fresh. And then when needed, you do this. So this is fantastic, because all the oil goes inside of you. Nothing gets wasted in the air. Nothing goes in your paint and your furniture. Nothing goes in your pets or your baby. Some oils are not safe for babies. Most oils are not safe for babies. And you get 100% of the oil where you want it to go. So this one, for example, is, I guess it's going to be reversed, but that's my headache blend. And when you have a headache, you don't want it to go in a room. You want it to go to your brain, right? So this way you get all of the oils, and the tube in your purse, in your pocket, will last you several months. Very economical, very safe. You can control how much oil you get inside of you. While if you diffuse, you have no idea how much you've been breathing. And you can count how many breaths you take. You can reuse as often as needed. So I really love this thing. Let's see, are there other ways to do inhalation? Spritzers. Some people like the room sprays. I make some room sprays too. So you can, instead of diffusing in the entire room, you can spritz locally. You can put some on your bed at bedtime, for example. Or you can put some in the bathroom and you don't have to just fill up the end. So that's very practical. I think that's about it for inhalation. Some cautions, some things to be careful about with inhalation. I already mentioned people, pets. You can over inhale. It is hard to overdose when inhaling, but it happens. If you breathe in too much oils, let's say if they have the relaxing oil, they tend to lower your blood pressure. You can start getting dizzy. If you take too much, they can interact with your medications. I have an inhaler here. I call these inhalers with rosemary and basil in it, which are two oils that interact with blood pressure medication. And a lady took one sniff of this inhaler and she was spinning for 30 minutes because she was on a really high blood pressure med dose. And that interacted with it and really increased the effect and lowered the blood pressure too much. So be conscious of what you're doing, which oils to avoid according to which medications you're taking and your existing conditions. Especially if you're taking a lot of medications, you might want to look it up. And that's one reason I love this book. It has all this in it, all the drug interactions, and a good aromatherapist can also tell you, now this will interact with this, so don't, you know. Where was I? Potion? Anything else? Some other ways you can overdose is if you inhale too much, you can start coughing. That is your body trying to get it out. Your lungs have had too much and they just don't want to breathe it anymore. So move on to fresh air, open the windows. If you have a diffuser in your house, so turn it off and open the windows to air it out. You can also get a headache if you breathe in too many oils. So you'll know if you start feeling off, just stop diffusing, stop sniffing. Okay. Move on to some fresh air. All right, the second way to use essential oils in general is topical, putting them on your skin. As I mentioned before, when you put them on your skin, these small molecules tend to penetrate deeply through the skin. The smaller the molecule, the faster it penetrates. For example, the limonene from lemon, that was the smallest molecule, penetrates very quickly, very deeply, while the beta-caryophyllene, the big heart-shaped one, doesn't penetrate as. It's going to be much slower and it won't go as. But they all penetrate to some extent. And as they penetrate through your skin, they do things to your skin. So if you're trying to do something to your skin, you will choose certain oils for that problem. And after they're done penetrating through your skin, they will get into your bloodstream and spread out everywhere else. So you want to be mindful that whatever oil you put here is not eventually going to stay here. It is going to spread out into your whole body. So if you put the oil of basil that lowers your blood pressure and you have blood pressure medicine, you put it here, make sure you don't put too much because eventually it will get into your bloodstream and might interact with your blood pressure. So the different ways to apply oils to how it works. So penetration, okay? And the dose for essential oils when you're trying to treat something is a function of the area, the size of the area where you apply it, times the concentration, how many drops you put in your blend, as in percentage. Let's say, is it a 5% blend, or is it a 10% blend, or 1%? And how frequently you apply it. So when you try to calculate the dose of how much oil you need, you have to take all these things into account. What is the surface area? You're putting it over your entire bag, or you're just putting a little bit on the knuckle. If you're using oils on a large surface area, you're going to want to reduce the concentration so you don't overdose yourself. And so I make a blend for pain in a roll-on. So roll-on this This is one. And at first, I was making it 10% strength for my muscles. I get back pain. And my husband was rubbing it on. And then I noticed that afterwards, I was always very thirsty. It dawned on me that that was my body trying to flush. It was too much. It wanted a lot of water to start flushing the oils because it was too strong. Because it was a large area. It was my entire back at 10%. That was just a little too strong. So I reduced the blend to 5%, and I don't have that first problem anymore. So you want to use the right dose for the job. You want the blend to be strong enough to get the job done that you need, but you don't want to overdose yourself because they are powerful products and there might be consequences. They won't be as dire as with some other products. They're mostly safe, most essential oils. There are very few accidents that happen, but they do happen. I have a long list of stories of bad things that happen to people, but I won't. That's not the topic today. So just be mindful. And if you make your own blends, you're going to have to study to make them properly. Okay, so topical, let's see. So you can, so to apply topical, you can make a roll-on, rub it in. You always want to rub it in so it passes through the skin. If you're not trying to pass through the skin, if you're trying to make a perfume, therapeutic perfume like this, then you don't rub it in. And I put some on earlier to relax for the talk because I was rushing around all day and I was like that. So I put some in my neck. I started yawning and breathing deep. And then by the time I met birds, I was much more relaxed. So this one you don't rub on because you want it to sit on your skin and evaporate so you can smell it. If you rub it in, it will cross the skin, go through the skin. If you want to smell it, then you don't rub it in. Other ways to get oils on your skin, you can make a cream, you can make a spray, well made, not just water and oils, because it's like having pure oils because water and oils don't mix. So as the water evaporates, you're left with pure oils on your skin. And that can spell trouble. You can come up with allergies or chemical burns. And also, if the oils are on their own, they evaporate faster. So when I make a spray, I always like to do approximately 50% water phase, 50% fatty oil, like coconut oil, and then a little bit of surfactant to allow them to mix. This way, after the water evaporates, you still have the coconut oil to dilute your essential oils, and it makes them last longer on your skin, like for a bug spray. And it also protects your skin from the pure oil. So you have diluted oils going on. So it's double good. Okay, so I'd say when you make a spray with just water, that's kind of lazy and it'll work in a pinch, but then eventually it can spell trouble and it won't be as effective. It's fine for spraying the room, but for putting on your skin, you kind of want to do 50-50 water and coconut or water and jojoba or something like that. Okay. Another way to get oils for your skin is in a bath. Be very mindful of your tender areas in a bath. And you probably also want some bath soap, like bubble bath or something, to kind of help your oils disperse. Otherwise, it's just going to sit on top because oil and water don't mix. So if you just put a few drops of essential oils in the bath, first get in the bath first, then put the oils. Because if you put the oils first, then you get in the bath, you can burn yourself on the way down. So get your oils and or use some kind of soap. So you can use Castile soap, liquid Castile soap, that's very good. Or you can use some bubble bath, something to disperse your oils, and then the oils will go for your skin. You can put some in the shower while you shower, but that's more for inhalation. They will get vaporized by the hot water, and then you will breathe them. Okay, that's all I think of for topical for now. And the third way to use essential oils to get them inside of you would be internal. There are several different orifices. Sorry, I have to say it, but the expert aromatherapists don't use only the mouth. They can also use the back door, anal, and that's called a suppository. I have not used that yet. I haven't had to, but let me explain. So when you heat oils, you do this when you need a bigger dose. When just the skin or inhalation, it's not going to cut it. Or when you're trying to treat your digestive system, you're never going to get to your stomach by putting it on your skin or your gut. So in this case, this is when you eat essential oil, but you must very well know what you're doing. You must work with a professional because there are much more side effects and cautions when you are eating them than when you are rubbing them or smelling them. There can be a lot of interactions, and some are a little bit toxic. So you really want to know the maximum dose, make sure they won't interact with anything else you're doing. So it's not something you do willy-nilly. So I rarely use ingestion myself. I use it as needed. For example, one time I was very not feeling great, nauseous while at work. And I had some ginger oil with me. I put 1 drop in my glass of water and drank that. And that took care of it. But that is not something I recommend because the oil and the water don't mix. So it's pretty much like taking the pure ginger oil. So once in a pinch, I will do this. But if I needed to take oils internally regularly, then I mix them into a fatty oil. I would put some in olive oil or in coconut oil or in honey, or my favorite is in black seed oil. Black seed is also called nigella, and it's very therapeutic. So I like to add essential oils to it also, and this way it's a 2-in-1. So I've been using this for my digestive troubles, for example. Very low dose of essential oil into a big amount of fatty oil. You want to be very careful. So when trying to kill something, let's go back to the suppositories. Suppositories are the most effective way because it bypasses digestion. If you're taking oils in your mouth, before they get to your bloodstream, they will first go through your digestion and get broken down. And so they're going to be processed into different compounds, and some of the compounds will be broken up and won't be whole anymore and won't be able to do the same jobs after they pass through your liver and kidneys and then get in your bloodstream. So it won't be as effective. You still get some of it, but a lot of it just is different. You can put them under your tongue and then it'll go straight in the bloodstream. But it's iffy because you can burn yourself depending on the oil, so you've got to be really careful with that. Better off diluting them and just. So if you do a suppository, there's a lot of vascularization in that area, and the oils get soaked up immediately into your bloodstream, and it bypasses digestion. So you get all the oils instantly into your bloodstream, and they get to course everywhere before they finally end up into your liver. So you get a whole free pass through your bloodstream. They go very quickly to your lungs, for example. So it seems like it's far away from the back door to the lungs, but it's actually pretty much a direct route to the lungs. If you're trying to kill something and nothing else is working. So personally, I've bought all the materials to make suppositories, but I've never had to because I've managed to kill things some other ways. To me, that's the last result. I know how to do it, but I haven't had to yet. So, but I know some friends who have used it when they were really, really sick, some aromatherapists, and it worked really well for them. Okay, that's how to use oils. And now we're almost out of time, but I want to move to a few examples. That's what you're all waiting for, right? Specifically, give us some examples. Okay, so I will use a couple of my clients as examples for their testimonies. I asked them what they liked the most of what they've been using and why. So first one, we call her Mary. I don't want to use her real name for privacy. And Mary says that oils have helped me tremendously with side effects from my cancer medications. So Mary has metastatic breast cancer. She's been fighting it for years and it's going okay. It's kind of steady, I would say. And so I make a few things for her to help her in various effects. So she loves peppermint oil. So she uses a tube like this, loaded with peppermint oil. And she says it helps her very much to fight the congestion before bed, helps prevent sinus problems that come from the medication that give her a lot of sinus infections. And it also helps her a lot with the headaches. So just as I was showing before. Portion goes in your head and a lot goes in your sinuses. So this is very, very effective for fighting sinus infections. She loves another inhaler that's called Wonder. And this one is very strong in menthol, but also camphor and eucalyptus. And so it's very good for trying to kill. Then Mary loves this tummy roller, which I created for various gut troubles. So to use this one, so it's a roller. So you butter up your entire stomach or intestinal area, then you massage carefully until it feels dry to make sure that everything went through the skin. From then on, the capillaries, the teeny tiny blood vessels in the skin, will carry the oils deeper into your tissue and all the way into your intestines. So this blend I created for inflammation, for digestive, for getting stuck. It helps things move along, to help relieve gas, to just stimulate everything. But Mary, after getting some radiations in her back, in the middle of her spine, her stomach was itched. And she was having a ton of reflux from the radiation. So she asked me if I had something for that. And I said, well, try this. I haven't used it for reflux. I don't know if it will work. And she's been using it on the trachea, on the esophagus. And she said she could feel instant relief. So that might also work for reflux. It's strong anti-inflammatory. So over here for reflux. So then she read that frankincense was really good for fighting cancer. So she asked me to make her something with as much frankincense as possible. So I combined sacred frankincense, which on its own has the alpha-pinene that we talked about, which is good for stopping some of the cancer processes, with a powder that is not an essential oil, but I like to dabble into other natural remedies too, not just the oil. I'm always expanding. And it's called boswellic acid, and it's from the frankincense resin. So I mix some of that powder and some of the essential oil together into a cream, because the powder only mix in water and the oil only mix in oil, so together it has to be a cream. And she's been rubbing this cream on everywhere to try and accelerate the healing process. And then she asked me to make an anointing oil, holy anointing oil. So that's a custom form, another custom formula I made for her. She wanted some frankincense, some myrrh, and some cinnamon. We saw earlier that cinnamaldehyde helps fight cancer, and so does frankincense. And myrrh has a very strong killing compound. So that is why it was used for embalming people, because it helps prevent any kind of decay. It kills, very strong against fungus, and probably good for cancer too. I didn't find it in the list. Maybe it hasn't been researched first, but I wouldn't be surprised if it's good for that too. So she's been taking this orally before bed. I made it a tincture in coconut and olive oil. Mixed results in there, and she thinks it's happy. She also loves elderberry syrup that I make to help her fight all these sinus infections, to get rid of colds faster. Oh, elderberry syrup made with fresh elderberries and a lot of spices. The spices help kill everything. Cinnamon, clove, remember clove, one of the best killers of cancer among the essential oil world. And I like to put many other things in too. But last but not least, Mary's favorite, which I saved for last, are her CBDs. I didn't mention CBD yet because it is not an essential oil, but it's a plant product I started playing with about 5 years ago now. CBD comes from cannabis. For those who don't know, it is a non-drug part of cannabis. So there's a THC that gets you high, and there's a CBD that does not get you high. But CBD is fantastic on its own, and better than THC in my opinion, because you keep all your faculties, but it has so many wonderful properties. It's an amazing anti-inflammatory, analgesic, helps relax you, helps with anxiety, helps with spasms, both in the brain and the muscles, helps repair the nerves. And I have some examples of that where I actually saw it work. Helps relax your gut, the digestion, helps modulate autoimmune issues. So if you have a lot of autoimmune issues going on, that helps calm that down. Also helps prevent cancer, anti-proliferative, helps calm your heart and protect your circulation, improves your body circulation. It's just so much going on with CBD. So I love it. And I started making CBD products 5 years ago. And what I like to do, I really like to blend the CBD with the essential oil to make the most powerful product that I can. So for example, Mary, this is one of the CBD she likes. So this is a very strong, up to the just below the legal limit in Pennsylvania of what I can make. So she likes a big dose because she has a lot of pain and she's trying to fight something, of course. And I added a little bit of blue chamomile to it. You might have picked up earlier that blue chamomile is one of the oils that helps fight cancer. And it's also very calming and it helped her with her reflux. So that's why I added the blue chamomile in there, because when she takes the CBD orally, it goes in the intestine and it really in the stomach, and it really helped calm the reflux. It's very, very calming. So I can combine oils and CBD together to emphasize certain properties of the CBD and make it work even better. Mary's last favorite blend is this roll-on. So this one, I also put CBD plus a lot of different essential oils. And this one is very minty. So it penetrates deeply and it really helps to relieve pain, inflammation. So she uses it locally on her arthritis, etc. So while we are on the range in the world of CBD, I have another favorite client who has been dealing with cancer for a few years, but it wasn't hers, it's her little boy. When her little boy was, I think, 2 or 3, she'll correct me later, they found out that he had leukemia. That is a news you never want to get, of course. And he reached out to me to see what I could do. And I created a blend for her here that says superhero, because I think that her little boy is a superhero for how he's been fighting this. And so when he started the chemo, he started losing the feelings in his leg. I'm not sure how to describe it exactly, but it's neuropathy. It attacks the nerves in the legs. Many of you might be familiar with this. And he started not being able to walk anymore. When his mom started rubbing this on his leg, within 2 weeks, he was running around again. And I repeated this experiment with another little boy with leukemia of about the same age. When I learned of him, I offered his mom this blend, and she didn't have any money to buy it, so we traded. She gave me some paintings. I have some beautiful paintings from her. And I made her this blend, and she had the same experience. Within only a few weeks, her little boy could walk again. And when my friend Annie, the first one, said about this, she said, it helped my son never lose the ability to walk. Unlike most of all the little cancer patients like him, he was one of the rare cases that experienced peripheral neuropathy during chemo, but reversed it after using CBD. Most of the kids who went through the same treatment had to go through physical therapy to learn to walk again. My son didn't. So this has been amazing. And to this day, so our son has been free from cancer for, I think, about 3 years now. But she still does this for me every few months, because I also designed it. I use the tables I was showing you in that book earlier. I looked up all the oils for leukemia, and I put all the oils for leukemia in. So it's not just the CBD, but CBD plus the essential oils for leukemia. And she credits it for helping for him to help him fight the cancer, and she keeps using it to keep him in remission, hoping to keep the leukemia at bay for him. So I find that really cool. And he's been doing fantastic. I'll finish with a few other products I have made for various people with cancer as examples. Different types of cancers. So there's, let's see, is this one? Oh, this one, okay. This inhaler is called Cruise. And I originally created it for a lady going on a cruise. It was for nausea, for motion sickness. So it worked well for her on the boat. But later, a few years ago, a local cancer services company, I can't recall the name right away, but they're based off Westchester, PA, where I am. They asked me to make about 1,000 of these to put in their cancer kits. And they said that the patients were very fond of them. So this is to help with the nausea from chemo, any type of nausea. In here, I have a lot of lemon, peppermint, and ginger. Ginger is fantastic for nausea. Grapefruit and spearmint. So there shouldn't be too much interactions with anything going on. So it should be safe for most people. You can also use it while pregnant, motion sickness, of course, you name it, just any type of nausea. Let's see. So when you learn that you have cancer or a loved one has cancer, of course, there's a lot of stress associated, and it can be really hard to sleep and from the pain too. So I have some sleep rollers that are very popular. There's one called Pillow Roll that you roll on your pillow, of course, or your pajamas. This one is called Relax, and you can put straight on your skin. So this one is purple because it's heavy on the lavender. I like to color code the product so it's easier to find the one you're looking for, especially when you're groggy and tired. So this one you just put a little bit on at bedtime, and it helps you sleep faster and deeper. Hopefully you get a better quality sleep, helps rest your mind. I like to make a few anti-stress and anti-anxiety products. So every single product I made was created because someone asked me. I don't make the product and look for people. I have someone say, hey, can you make something for this? So every product I could put the name of the person I first created it for on it. And so they all have a cool history. And so Calm was first created for ADHD in children. But the moms loved it so much that they asked me to put it in a roller. So first it was an inhaler for ADHD. They wanted to wear it themselves, and the moms have been stealing it from their children ever since. It smells really nice. There's a little bit of jasmine in it. And jasmine is one of the oils being studied for cancer, actually. There's some very cool properties. There's some vetiver, some chamomile in there. This one is to help calm the daily anxiety. It helps keep you more even keel and calm the overwhelm in the brain. Soulmate, I was thinking might be of interest. It's a blend heavy in rose and jasmine, but the rose has the special property of helping to deal with grief. It kind of tends to reach in your soul and give you a little massage. It's a pretty powerful oil. That's the one I put on when I was stressed before starting the talk. And so rose is just very multidimensional and has some good power for people who just you're feeling a little depressed and stressed at the same time. Rose might be a good oil for you. What do I have here? A cancer patient who was recovered from breast cancer asked me to make her a blend to help prevent the cancer from coming back. So I named that Boob Juice. I like to give them cool, funny, short and to the point names, right? And she's been wearing it to try and keep her breast healthy and prevent the cancer from coming back. And to make this blend, of course, I used my tables and I looked up the oils that are good for breast cancer and I put them all in there. And I had another lady last year who needed some boob juice too, so I made her one. There's all the pain blends, which I have some others to show you. Showed you the cool stuff, but this one is called muscle rub. I also like to make them in a pump because sometimes rolling is not the, like if it's in your hand, for example, it's kind of hard to roll on your knuckles. So I prefer pumping it on it, it's faster. Yep. The formats can change, but the content is the same. This is not an oil, but I really, 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 really like it, and I'd really like to tell you about it. Okay, when there's a lot going on, a lot of health issues, the first thing I always check is if people think they have a high toxic load, and might they profit from detoxing? because as you know, the inflammation in the body really feeds on the toxin. When your immune system is overloaded with too much going on, that's when it starts malfunctioning. It can cause autoimmune issues. Cancer, as you know, feeds on toxins also. The oxidants that destroy DNA in the first place are toxins. So in addition to essential oils, and not just for cancer, but for all of life. So this is a zeolite product, and it's a nano zeolite, meaning it's a smallest particle size. You spray it under your tongue, and it goes in your bloodstream, and the zeolite is a toxin magnet. The toxins are magnetized by it. They get stuck inside the zeolite cage, and then you pee it out. So this could be always recommended to try and get a clean baseline. Remove, before you add more things into your body, before you throw a bunch of oils and CBD and you name it, other supplements, maybe it's a good idea to first remove what shouldn't be in there. Because after that, everything else you add will work better, and you're not overtaxing your body with all these different things that are floating in there that shouldn't be in there. Talking about heavy metals, mycotoxins from mold infection, or maybe leftovers from Lyme, leftover adjuvants from vaccine, or you name it, foods, the junk in the food, the glyphosate, all the dirt that shouldn't be in there. So this is, if your liver functions well, you need to have a well-functioning liver. Use this because your liver will need to process everything that gets captured. So that's a criteria here. If you have that, if your liver is in good shape, then you can try this to detox. What else do I have on my list? I was thinking of one more thing. For the hair loss, I also make some skin products. So this is called hair serum, hair and scalp serum. And in this one, I designed it to help the hair grow back faster. So it increases vascularization and stimulates the follicles to help the hair grow back faster. Just a fun blend. Many more you can do with essential oils if your skin is really cracked and dry. There are many different options you can put on there also. So it really depends. There's just so much going on as side effects and quality of life. So the options are infinite. One oil can do 100 different things, and there are hundreds of different oils. So you name it, there's an option. There's an oil out there.
Wow. Thank you. That was phenomenal.
You're welcome, Bert.
Yeah, it's opened up for questions, but I do want to start with I have a bunch for you.
Go for it.
So the oils like cinnamon and others that can be very strong, can they be purchased pre-diluted, or does one need to dilute them after? But do they buy them as they are and then dilute them?
So usually in stores in e-commerce, first I would say avoid Amazon. Find the good oil sellers and go directly to their websites, because all the fakes, all the fraudulent, bad quality oils are sold on Amazon because there's zero controls. Okay, so if you go to a good oil website, most of the time they sell you the pure cinnamon. But you can talk to an aromatherapist like me, and they'll make you pre-diluted to a safe level cinnamon, for example. And cinnamon is very aggressive on the skin, but it's not as aggressive eaten. It's actually made to be eaten. So on the mucous membrane, you can use a much higher percentage than you can on your skin. So on your skin, the highest you can use, I think, is 0.1% or 0.05%. But in an oral blend, you could go up to 1% without burning off. Because we have the histamine process in our outer skin is not at all the same as in our mucous membrane. So on your skin, you will trigger your histamines, but you don't have any in your mouth. So it's actually safe to eat. The same happens with lemongrass. Lemongrass oil is also highly allergenic on the skin, but safe to eat. So there are several oils like that.
Okay, thank you. And you mentioned the yellow flower that you use in the first aid oil. Can you spell that?
Helichrysum, Helichrysum.
Thank you. I found that fascinating.
Mm-hmm.
You said that citrus oils need to be refrigerated. Now, is there simply a shelf life, or can one smell the oil and get a sense that it's getting old?
Yes to both. If you don't refrigerate it, the average shelf life is 1 year, but that really depends on how much air is in your bottle. If your bottle is still brand new and unopened, what makes citrus oils and all oils oxidize is oxygen. That's why it's called oxidize. So the more oxygen is in your bottle, the faster it will oxidize. So if you have a brand new bottle of lemon with only a teeny bit of air at the top that you haven't used and it's older than a year, it's probably still good. But once you open it and you start getting more air in there, stick it in the fridge.
Wonderful. Thank you. Okay. Just looking at the chat here. Thank you. Very interesting. I look forward to listening to the recording again, since there was so much information to take in during this one. Great. You're so welcome. You said, let's see, what was the next question I had? I got the sense that a suppository oil could actually be quite strong because of all the blood vessels there, right? You probably have to have one probably wants to get a little assistance, not do that on your own, right?
Yeah, you want to formulate it properly.
Yeah.
I would not use the most aggressive oils for that, or you might be itching and burning for a few hours. So you want to use some milder oils. If you need some aggressive oil like oregano, I would just make it a very small fraction of the blend.
Got you.
But some very mild oils like frankincense or lavender or marjoram would probably be safe enough to put back there.
Thank you. And the nausea product that you make, as you said it had a little bit of grapefruit in it. So might one want to keep that in the fridge, or is it different because it's a blend?
Well, the inhalers, what I found is if you keep them in the fridge, you forget to use them. So what I do is I keep them in my freezer until I put them on the shelf, until someone buys them. And I tell people, if you want to use it for a while, put it in the fridge or in the freezer, even better. If you have a bout of nausea and you need it, then you get it out and you keep it in your purse. But once you're done with it, then stick it in the freezer so it's fresh again the next time you need it.
Okay, wonderful. So thank you so much for giving us your time, and please provide your websites and what contact info you would like.
On my website, it's easy. It's drfrenchy.com. So it's Dr. Frenchy with a Y, Frenchy. Maybe I can show a picture.
Yeah.
Let me see if I can find one of my logos. I didn't prepare for that. Oh, I have a little card with all my information on it. I can screen share. This one should be good. There. Oh, that one. Yeah, that one should be good.
And I can put it at the end of the video too. Just have it.
Oh, sure. And where am I? There it is. All right, so if I do share screen, this one, oh, there. I don't know if you can see. Great. Still have the helichrysum in the background.
Perfect.
Yes, so drfrenchy.com is my website. And when you click on there, there's my email. I do a lot of consultation on Facebook, by text. There's the essential oil aromatherapy CBD world is a little complex, so I love to guide people who don't know what they need into choosing the right product. And if I don't make the right product, then I'm constantly creating new ones. Every month I create new formulas because someone needed something specific that I didn't have yet. So that's why I call this custom aromatherapy, because I'm always creating whatever people need.
Wonderful. Thank you so much.
Oh, one thing, the CBD is not on the website because my website provider, we had an issue. They're not very CBD friendly.
Really?
No. They don't like, no, most websites and most payment processors do not like CBD. There's still a stigma attached to it, even though it's been fully legal for several years. And so, yes, so just contact me directly for any CBD. And
Wonderful. Thank you so much.